starting from 1850s. Researchers like Tade wrote that suicide resulted from imitation behavior, while two statisticians of the time explained that the rise they noted in the rates of suicide was due to modernization. Émile Durkheim, a French sociologist, believed that social factors were responsible for suicide, as he tried to explain the suicide rates and why one group he studied had a higher rate than another. He explained this by focusing on low and strong social integration of an individual within a society and too little or too much social regulation of an individual by the society. And so he came down with 4 types of suicide. Suicide has become a major cause of mortality globally. It's estimated to account for about 1 million deaths annually. This makes researchers believe that at least 1 death results from suicide every 40 seconds. Globally, for every completed suicide, it is estimated that there are about 25 more attempted suicide. Suicide rates have increased globally, thus constituting a major public health body. The rates are grossly underreported globally, but more so in developing countries like Nigeria. Basically in Nigeria, because of issues of stigma, families don't want to tell the public that somebody has committed suicide in their family. Suicide is the 3rd leading cause of death among young people aged 15 to 44 years and ranks 2nd for adolescents between the ages of 15 and 19 years, coming only after accidents. We do know that the family and close associates of individuals who commit suicide often have psychological burden from feelings of guilt, sorrow, and anguish. They feel that they did not do enough to save the situation. Suicide rate was reputed to be very low in Nigeria. In a study by Tolani Asuni, between 1957 and 1960, he studied coroner's reports in the Western Nigeria among Yorubas with a population of 6.5 million people. He reported then that less than 1 in 100,000 people committed suicide. However, events of the past few years have shown that suicide has become a social menace that cannot be easily wished away again. The topic today, suicide, a myth or reality, will be discussed by 2 of our professionals. The first person, Dr. Stephen Oluwaniyi, is a consultant psychiatrist. He's a fellow of West African College of Physicians. He's the head of training and research in the hospital. He heads the forensic psychiatric unit and has been working for more than 14 years as a consultant in this hospital. He is also an internationally certified addiction professional with ICAP 1. The second person is Mr. Peter Adebuniya, who has over 15 years experience working as a psychiatric social worker in this same hospital. He too is an internationally certified addiction professional with ICAP 1. Ladies and gentlemen, please sit down and listen to our professionals. But before then, I hand over to Kemi Akintoyeshi, our moderator. Thank you very much.
Thank you so much, Ma. You will always know that the medical director doesn't just welcome, she also gives bits and bits of information. And she had also opened the floor today to tell us what suicide is, as well as what's the prevalence and some of the major problems that we have about suicide, even in our nation, Nigeria. And yes, she has called it a menace, and that is what it is indeed. And that is what we are looking at today. Dr. Stephen Oluwaniyi is going to open the floor by giving us his view on this topic of discussion today, suicide, a myth or reality. You're welcome, sir.
Thank you so much. Good afternoon, everyone. Let me first thank the medical director, Dr. Osi Ogun, for the privilege given me to present this talk on this important topic, suicide. Human beings are born with a natural instinct to preserve their lives, but we know there are times when people wish for death, and unfortunately, some do succeed in taking their own life. Suicide is the act of intentionally taking one's own life. And it's a global phenomenon. As has been said, about 800,000 individuals worldwide die by suicide annually, all over the world. The most common method of committing suicide is through hanging, use of pesticide, firearms. Other methods include jumping from heights and in front of a moving train. Now, based on WHO estimates, local studies, and media reports, we know that rate of suicide has become extremely high in Nigeria in recent years. So the purpose of this webinar is to disseminate information about effective interventions, preventive measures, so that everyone will know his or her own role to play. Prevention of suicide is not for health workers alone. We cannot do it alone. But we shall see within the time allocated to me that every one of us, be it a teacher, a nurse, a religious leader, a community leader, we all have roles to play in making sure we curb the menace of this evil phenomena. Now, but we cannot discuss any meaningful intervention without understanding why people carry out suicide in the first place. That is talking about risk factors. What are those things that increase the vulnerability of an individual to suicide? We can talk about individual factors, talking about genetics and biological factors, family history of suicide, previous attempts at suicide, most importantly, mental disorders and substance use disorders, that is use of hard drugs. These are some of the things that have been shown by research to increase an individual vulnerability to suicide. Certain cognitive factors like impulsivity, hopelessness, cognitive restrictions are also known to predispose an individual to act of suicide. When individuals experience personal and financial loss, loss of status, experience of physical illnesses, especially chronic or painful illnesses, that or terminal diseases like cancer, have also been shown to increase the risk of suicide, unemployment, poverty, and those who are incarcerated, prisoners. These are individuals that have increased risk of committing suicide. Now, when there are difficulty in relationship, conflict in significant relationships, like between spouses, children and parents, siblings, these have also been shown to increase the risk of suicide. Sense of isolation, lack of social support, significant factors that increase the risk of suicide. Now, in the community, when you have a defective health system with physical, financial, and socio-cultural barriers preventing easy access to healthcare, in such community, the risk of suicide will be high. In community where you have wars, disaster, conflicts, and you have internally displaced people, asylum seekers, such individuals are prone to increased risk of suicide. Subgroups within the community that are discriminated against, those like are victims of bullying, people with disability, people living with HIV, and even those with mental disorders are also known to have increased risks of suicide. Also, community where there is increased access to means of carrying out suicide, when it's easy for individuals to get pesticide, drugs that can be used to poison themselves, or when there's easy access to tall buildings, bridges where people can jump from, these have been shown to increase the risk of suicide in such community. When we have inappropriate media reporting and use of social media, which is so rampant these days, You have situations where people post pictures of somebody who has carried out suicide, and they give graphic details of this. This definitely will increase the risk of suicide in the community. We have people who will now carry out copycat suicide. So this should be discouraged. Stigma associated in any form with help-seeking behavior. When people, because of stigma, they don't want to come out to treat their mental disorder, they don't want to treat substance use disorder. These are things that increase the risk of suicide in such community. We should also not forget criminalization of attempted suicide. When it's a crime for someone to attempt to commit suicide, then individual will not want to come out for treatment. And this is a big problem in our country. Most part of this country, except Lagos State, attempted suicide is a crime. And imprisonment of 1 year is prescribed. But fortunately, Lagos State has amended its own law, and compulsory hospital order is what is recommended. So such an individual will be brought to the and appropriate intervention will be carried out. Now, we can also talk about the protective factors. These are things that increase resilience in an individual and serve as a buffer against suicidal risk. Such things like strong personal relationships. When you have religious, spiritual beliefs, and positive coping strategies and well-being have been shown to protect against the risk of suicide. So what can we do? Again, we should know that there are certain signs, like you may see in an individual, that will point to the possibility of imminent suicide. When you see an individual who is talking about wanting to die or to kill himself, take such an individual seriously. If an individual is asking for means of killing oneself, you should also take such an individual seriously. When an individual is becoming increasingly anxious, agitated, reckless, or talking about being a burden to others, then something must be done quickly to help such an individual. So what can we do? What are the recommended interventions to prevent suicide? Let's talk about universal strategies, things that can be done in the community, addressing the community as a whole. We must improve our access to health care. When we do this, it will be easy for people to come for treatment for both physical and mental disorder, and this will definitely reduce the risk of suicide. We should promote mental health. We should reduce harmful use of alcohol and hard drugs. And I must talk about the need for us to pass an appropriate mental health and substance abuse law in Nigeria, because we don't have one in Nigeria. Again, Lagos State is in the in the forefront. They have passed their own law for mental health and substance abuse law. We also don't have a national suicide prevention strategy, which has been shown all over the world to drastically reduce the risk of suicide. There are isolated efforts at preventing suicide in Nigeria, but we don't have a national suicide prevention strategy. This we must work on quickly. We must eliminate stigma in all ramifications against mental disorder, against substance use disorder, against suicide, and other disadvantaged groups. When we do this, and we must also limit access to the means for carrying out suicide. We must promote responsible media reporting. When we do all this, we know that there will be a reduction in the risk of suicide. There are individuals called gatekeepers. These are individuals by virtue of their position that they work closely with vulnerable individuals. We're talking about primary health workers, teachers, religious leaders, community leaders, law enforcement officer, social welfare officer. These individuals should be trained properly to identify and refer those who are vulnerable appropriately. When we do all this, there will be a drastic reduction in the risk of suicide. And this is what the message we are preaching today. Let's remember, every soul lost to suicide is one soul too many. Fortunately, suicide are preventable, and it is important that everyone should play his or her own part in this fight against suicide. We should all work together to eliminate the menace of this evil phenomenon. Thank you.
All right, thank you so much, Dr. Stephen Oluwani. He had loaded us with basic information that we need on suicide, and he had been able to take us through what suicide is, as well as the prevalence rate in this nation. Yes, he has told us about the different methods that people use in committing suicide, as well as the risk factor, and it's a long list. We're still going to go into some of these bits and bits because we have to look at those cultural issues that are affecting our nation, and then he has also dealt with the barrier to effective intervention. And there's also talk about legalization. We're still going to talk more about that as we go on so that we can understand effectively what are the realities, what are the myths when we're talking about suicide as a whole, even in this nation. Yes, please know that we are also streaming live on the Facebook of the Yaba Voice. So just like our page, and then you could just get access into the page, and then you can follow us and watch this as it's going on live now, as well as yes on the Zoom. Please share, let people know that we are live now. We're talking about something very serious. You know, sometimes people talk about this and it's like a hush hush things. You know, don't mention it, don't talk about it, and that's the reality. We're looking at this, and it's very, very important. And so for us, this is also very, very significant because we are passing very, very salient information to everyone around us to be able to understand. And then please know that if you have questions or comments, just type it on the chat box, but we'll take it as we go on. There's nothing that is so small. Please, whatever comes to your mind and you want to make clarification about, we will take it. I will go straight to the next presenter, Mr. Peter Denibuyon, who will also be talking about to us on this reality and the myth of suicide. It's going to come from a social work perspective and look at some of these cultural dimensions as well as the religious belief and some of the myths that are associated with suicide. Over to you, Mr. Peter Denibuyon.
Thank you so much. We'd like to look at types of suicide, and from there we'll be able to look at other issues that are relevant to suicide in our society. According to Emily Durkheim, he also gave 4 different types of suicide. But like Dr. Luwaini said about suicide, is an acute, deliberate act of self-harm resulting in death with at least some intention to die. That shows that suicide is when someone has intention to die. So looking at Emily Durkheim, in his own perspective about the different types of suicide, the first one he talked about egoistic. That's when you have some individuals who are not well integrated into society. They feel as if they are not part of the community, and the community also feel that these people are not part of them or their lifestyle. So this set of people can commit suicide. Let's look at the case of a Becky. A Becky is a loner. He doesn't have a child, no work, nothing. He doesn't even have any future. So this kind of person can commit suicide in our community. What about autistic types of suicide? These are the kind of set of people that can lay down their life for the society. When we talk about suicide bombers, especially what happened in United States of America in September 11, there are people who hijack plane and they attack the World Trade Center and the Pentagon. And what happened? Almost 2,996 people lost their life. Apart from that, 25,000 people were also injured. And these are the people that also have families and they are part of our society. What about anomic, which is also part of types of suicide? Rules and regulation of society, if it is disrupted, it can also affect the livelihood of people. For instance, if someone is unemployed, if there is economic downturn or the disaster, these are the things that can really affect people that can make them to commit suicide. Then we also have fatalistic types of suicide. These are the kind when individuals find themselves helpless, hopeless, the life is meaningless to them, they might tend to commit suicide. For instance, if you look at a slave doesn't have any hope. He doesn't have any time that I'm going to get out of my master. He's going to serve the master for the rest of his life. So that kind of person can feel like ending his or her life. Let's look at some recent statistics like Dr. Oluwani have rightly said. According to WHO, 9.3 million adults have suicidal ideation. 2.7 million adults have attempted suicide. 1.3 million adults have attempted suicide, and 800,000 people have died due to suicide every year. And this is a global and worldwide phenomenon. It affects every person. Like what my medical director said, at every 40 seconds, people die, people kill themselves. Now, let's quickly look at religion and cultural perspective, or their perception or their belief about suicide. Islam, for instance, now, if you look at Quran Surah 4, ayat 29, it says, and do not kill yourself. Surely God is most merciful to you. So they forbid suicide. What about Christianity? The Christian believes that if you commit suicide, you go to hellfire. And because of that, people believe that suicide is a sin against God and against humanity. What about African traditional religion? They also have a kind of, they also frown about it, that suicide should not be encouraged because of stigma, because it's going to result into stigma to the family of the victim. Let's quickly look at some cases of suicide that we have in our country, especially in Nigeria here. What about the case of a lady who became pregnant, and her grandmother insisted that she must leave the house? She left the house, she packed her things, she left the house, she went to her boyfriend's house, and from there, he took sniper. And a lot of examples like that we have in our community. What about a medical doctor that jumped? So we have a lot like that. Even socio-economic challenges can even make someone to commit suicide. For instance, a man who killed his wife, killed the 3 children because he couldn't fend for them. This as a result of socio-economic challenges this man is facing in our community. Now, today we are talking about myths about suicide. There are a lot of beliefs that people believe that suicide is not real. Like people believe that suicide only affects individuals with a mental health condition, and it cannot affect any other person. Also, people also believe that once an individual is suicidal, he or she will always remain suicidal. People also believe that whoever dies of suicide they are selfish and they take easy way out. And people also believe that talking about suicide will lead to and encourage suicide. All these are myths which are not real. Now, let's look at scientific causes of suicide. Here, I'm able to classify them under 2. The first one has to do with mental health. The second one has to deal with stressful life circumstances. When we talk about co-occurring mental disorder, that's when you're having 2 dual or comorbid. When you're having mental health and you're also having some other issues of life, can also result to someone taking his life. Let's look at depression. Depression is common. Most of the time we find ourselves unhappy, sad. But when it comes to clinical depression, we can see that that person can take his or her life. What about anxiety disorder, post-traumatic stress disorder? What about personality disorder, antisocial behaviors, substance use? These are few examples that we can also point out. What about stressful life circumstances, loss of job, divorce and separation? There is a particular DJ who killed himself because he has a kind of issues with his wife, and the wife left with the children, and she couldn't cope, and he ended it there. What about legal problems? A lot of people are having issues in the court pending for many, many years, and the thing has not been resolved. So what do? They have to look for a way of ending their life. Then we also have some method where some people also try to end their life by jumping into lagoon, reckless driving, using medications, and especially using gun. But before someone can take his or her life, there are always a warning sign. We have direct warning sign, we have indirect warning sign. What are the direct warning sign? The person will be talking about wanting to die. The person will be giving away all his property and saying goodbye. Hey, take care of your siblings, so make sure you do this, make sure you do that. So the person is giving a kind of a warning sign that he might leave the world or kill himself. What about having access to all these things they can use to kill themselves? Then we also have indirect warning signs. Then we have when people feel that they are purposeless, they don't have their life is meaningless, and also believe that they have been trapped. They have this kind of perceived notion that they have been trapped in a terrible, terrible situation, and there's no way out. And the best way is for them to kill themselves. Then what should we do as a professional and as a listener? When you interview someone and that person give you yes, I want to kill myself, don't allow that person to just go like that. Try as much as possible to gather more information. And that's what I call gather information, assess supervision, take responsible action, and extend the action. How do we do that? First, you have to ask the person, can you tell me about suicidal thoughts? Then after you gather all those relevant information, then the next thing is to make sure that you invite family members also to corroborate information. If possible, check some records. Then as a professional, check the direct and indirect warning sign. Then the next thing is to make sure that this patient is put on MAT. When I talk about MAT, I'm talking about medication-assisted therapy. Let this patient be well medicated, and it can also help to resolve a lot of issues. Then escalate the level of treatment. Let the patient be hospitalized for a while so that they can monitor the progress. And when this patient is being discharged from the hospital, follow the patient back into the community and make sure that all those things that this patient can use to kill himself are being taken care of. So what are we taking home from here today? We should also believe that suicide is real and not affect individuals with mental health condition, but also other life stressors. Once an individual is suicidal and with adequate intervention, he or she will be better. Then people who die by suicide are not selfish. Majority of those that commit suicide were depressed at the time of commitment. Then talking about suicide will lead to prevention, treatment, and encourage people to live a better life. So what are we taking away from here today is that our health workers should be well psychoeducated and well trained about prevention and treatment of mental health. And when people having this idea, suicidal ideation, they should be able to help them to resolve it. Thank you so much.
All right, thank you so much, Mr. Peter Deniboyon. He had been able to deal excessively with that topic, and he had told us what suicide is, what are the risk factors, and he also looked into the myths, some of those things. We're still going to explore. Please, like we said, we want comments, we want questions on these things, because they are core issues that is actually happening in our society. We want to hear your view, want to understand what you think about this. We want to know questions that are ranging in your mind that you want answered, so that this is why we are doing this today, to be able to help people understand adequately what suicide is and how we can help people deal with it appropriately. I'm going to be asking some questions here. I'm going to go to Dr. Luani, and then he's going to tell us to, yes, we know that suicide is something that we do hush hush. Even when people want to kill themselves, you know, there is a saying in Yoruba, apologies to people that does not understand Yoruba, they will say, if you won't fair kushere. But now people will tell you, I want to die. And then actually they really want to die. What are the barriers to effective intervention in our country? What are the barriers to people not actually getting the help, the support that they need to be able to get themselves out of this suicidal state or ideation or thought, or whatever it is that they have to deal with? Thank you, sir.
Thank you, Kemi, once again. There are a number of barriers to effective intervention against suicide, and I mentioned some of them when I was talking earlier on. But the first thing I would like to emphasize is, from your description about hush hush. That culture of hush hush about suicide itself is a barrier. We should talk about it. You know, there's one of the myths is that if you talk to somebody about suicide, you may implant the idea in the person's mind. This is wrong. We must talk about why we are doing this. We must talk about suicide. It's a problem and it's a reality. So disseminating information about suicide, letting people know that it's real, but it's preventable, is the starting point of removing this barrier. Stigma. When it has become a cultural thing, people don't want to be associated with mental disorders. People don't want to talk about that any of their relatives is using hard drugs. Nobody wants to discuss that his or her relative has attempted suicide. When there is stigma against these issues, people won't be willing to come forward. They will hide it. And when you hide this problem, you can get effective treatment. Again, how available are these services? We must make them available. I'm aware people travel as long as 20 kilometers to come to access care here. These are physical barriers to health care, and the financial barriers when people find it difficult to pay for these services. Also, that's why I talk about we must have a coherent national preventive strategy against suicide and other related affairs. So these are some of the things that serve as barriers. If we disseminate information, people are well enlightened, and those I call the gatekeepers. These are people that work with vulnerable individuals. I'm talking about law enforcement agents. We talked about religious leaders. You can imagine somebody who is a pastor who has been trained to notice changes in a member's life, that there's a drastic departure from the way this individual is behaving. He may be in a position to pick that individual and refer for appropriate treatment. So these are the barriers and these are the solutions to this issue.
All right, thank you so much, Dr. Luwani. He has also been able to talk to us about some of those barriers. All right, before I go to Mr. Peter, there's something I want you to address quickly, sir. Dr. Luwani, once again, before I go over. Why is it that some people become suicidal, why others with similar risks? You know, you mentioned quite a lot of risk factors earlier on when you were going on in this. Some people, yes, with the same risk factors do not commit suicide. Why others with similar risk, yes, go on and commit suicide? Why is there such differences between them?
Thank you, Kemi. I talked about risk factors, but I also talk about protective factors. So it's like a balance. When we can look at it this way, when the risk factors outweigh the protective factors in an individual, then that individual may give in and carry out suicide. So what are the protective factors in this individual? And we must emphasize them, because as we are trying to reduce the risk factors, we must strengthen and play up the protective factors. I talked about people having strong personal relationships. Maybe I should give an example. Two individuals, the two of them have suddenly lost their job. This is a stressful life event. So their means of livelihood has been taken away. But Mr. A is a loner. Living alone, he doesn't have strong social support. And possibly, he doesn't even have a religious belief. I'm not saying everybody, but I've discussed that people who belong to religious organizations can serve as a means of social support to them. The other individual, Mr. B, has a close circle of friends who quickly came to his aid after this experience. He has a church or a mosque where they rally around him and the family, and they're able to offer support. And Mr. B is somebody that when he started experiencing not able to sleep very well, he quickly goes to discuss with his doctor, and the doctor takes appropriate steps to help him. But Mr. A, he was noticing all these symptoms. He didn't talk to anybody. You can see Mr. A is most likely to succumb to something negative like suicide because he doesn't have protective factors protecting him against the same experience that the two of them has had. So these are the reasons why an individual may become suicidal and somebody else may not, and they are facing the same issue. I hope I've answered the question.
Thank you so much, sir. If there's nothing that we're taking away from this webinar today, please understand that if we strengthen the protective factor, then we will reduce the chances of this individual who is prone to suicide committed. And so the most important thing is strengthen the protective factor. And Dr. Luwani had been able to tell us some of this. It's about bonding, connection, interaction with people. That helps us to strengthen the protective factor, and then we are able to help people go through or navigate their experiences adequately. We have some questions in the chat box. I will be taking them shortly. Please just know that we still welcome more questions. If you have clarifications you need to make or comments, we would be happy to address that. Mr. Peter Deniboyo, please, can you are people actually wrong for blaming those that committed suicide? That's a question from Moses. Moses, thank you, we acknowledge this. Are people actually wrong for blaming those that committed suicide?
All right, thank you so much, the moderator. The question we are asking is, are people actually wrong for blaming those that commit suicide? I think yes, professionally they are wrong in blaming them because these people, they have a lot of issues that is affecting them biopsychosocial. biologically, psychologically, and socially. And because they have these underlying issues that have to be well cared for by professionals, they don't just look at those people and start blaming them. We have a lot of people that lost their job. We have people who have separation problems or divorce. We have a lot of people that have legal problems. We have a lot of people that have major and sudden financial losses. We have people that have social isolation. You can imagine in a society when you have what it takes to be a man, you see a lot of friends around you. People want to come to you. People want to be your friend because you have what it takes. You have the money, you have the influence. But once all those things are out of your life, you see that all those friends, you will not see them anymore. And because of that, you may tend to take your life because all those people who are there for you, they are thinking that they will be there for you. They will not be there for you in terms of need. So there's no need for us to blame these people. What we have to do is to arrange for them to see the specialists so that they can take adequate treatment. This life stressors is always there and will always be there. And even in this period of pandemic we are all facing, there are a lot of people who are going to have this kind of tendency to have suicidal ideation. But once we notice these direct and indirect warning signs, we should be able to direct them to appropriate quarters whereby they can get good information about how to go about it. Thank you.
All right, thank you so much, Mr. Peter Adenibuyan, for answering that question for us. What he has been able to tell us is the person who committed suicide does not want to die. They are dealing with something that is really overwhelming. And it's because of the pain. They want to just get away from the pain. So you can't blame somebody who actually wants to get away from the pain. And that's what they are dealing with. So we need a lot of understanding to be able to deal with it. Mr. Daife, thank you for your question. And she's also appreciating the presenters. But she's asking a question. Dr. Luani, I wanted to take this, sir. What help do you render to a victim that does not show any warning sign? And remember, one of the myths about suicide is that suicide occurs sometimes without warning. Does it actually occur without warning? I said, what help do you render to a victim that does not show any warning sign? Over to you, sir.
Thank you. Well, let me first establish that it's extremely rare for someone not to show any sign before carrying out suicide. It's extremely rare. I don't want to say it's not possible. So what is most likely is that the signs or the indicators were not picked up. Of course, if an individual is behaving normal, everything is okay, going about his normal daily activities, it will be hard for us to be asking around everyone, do you feel like killing yourself? So there are always signs. I want to believe. And that's why we went through a lot of these issues. If you search critically, there will be one or two things that individual has been going through. Is it that the individual has a mental disorder? Because these people can come up with a false belief that things are not okay, what we call delusions. But if at that, because of that belief, their behavior, their ways of interacting will change. So most of the time, what you have is a situation whereby people around them, they were not able to pick this sign. And that's why we're talking about training and disseminating information about this so that we will all be enlightened. And I keep on stressing the fact that the health workers, there's very little we can do. It's those people who are living in the community with our brothers, our sisters, our parents. We should all be watch over one another. That's the only way. So if an individual is didn't show any, it's unfortunate if he or she was able to hide it. But if we are all sensitive to this issue that I've talked about, there's no doubt we'll be able to pick the indicators early and the proper thing will be done. So that's the way I can answer that question.
All right, thank you so much, sir. Dr. Luani has told us that there are always warning signs. And so you as an individual has to be able to pick up those signs. It might be subtle, but it's always there. So please, let's be watchful, let's be more sensitive, let's more be aware. Thank you, Dr. Koyejo. A question, which is directed to Mr. Peter Deniboyo. If someone talks about suicide and repeatedly joke about it, what can be done? You know, there is that adage that I said earlier, I feel but you know, it says somebody now talks about it repeatedly, jokes about it. What can we do for that person? All right, we are so sorry about that. We are back live. It's a technical itch. This is part of the new normal, and we are so very sorry. So we are going to go back to Mr. Peter. Please, Mr. Peter, unmute and kindly address that question again. Please take care. Thank you.
All right, thank you so much, the moderator. The question that Dr. Koejo asked about people who talk about suicide, do not do it. Well, probably she said people joked about it. There's nothing to joke about life. Life is precious. And looking at what we've said about religion, perspective, culture, and what have you, if someone starts joking about it, please try as much as possible to take that person serious. Report that person to someone that can be of help, especially professional to this person. Not that you report the person to another person keep on saying it, and become a stigma. You don't you say he wants to kill himself or herself. Report the person to a professional that will be able to receive adequate treatment or intervention on time. It will save a lot. Because when you talk about ideation or intent, we have what we call intent, is when you have is a conscious desire to escape from life. And when we talk about lethality, this is a method that can cause death. And when someone is talking about all these things, you have to try as much as possible to take notice of these little things and look for people who are well trained to help this person out. Don't just believe that because he's joking about it and it cannot be real. And that's why we said suicide is an acute, deliberate self-harm that can result to death. And because of this, you don't play with it. So if someone is talking about, I want to kill myself, I feel like taking my life, so because I'm having this issue, don't downplay about it. Make it a serious issue. Escalate it. Let other people who can help this patient help. Thank you so much.
All right, so what Mr. Peter had told us is don't joke with it. Even when it seems as if that person is actually joking, please be informed, be aware, be sensitive, because you don't know exactly when it will turn from a joke to reality. Um, Dr. Oluwani, are there services that one can have people tap into in Nigeria or internationally when it comes to suicide? In 1 minute, sir, because there are lots of questions on the platform.
Well, of course, there are many services. That's why we're talking about part of what we're doing today, the preventive aspect of it. We are disseminating information from Federal Neuro-Psychiatric Hospital Yaba, and all the mental health hospital, teaching hospitals, where we render services for mental health care. We also take care of issue that has to do with that. More importantly, our primary health workers, a lot of them are trained, and more should be trained to know how to talk about this issue, to elicit the information from our clients, and to know the appropriate steps to take. So the services, but we need more. We need more because of the population of the country, because of how vast the country is. We need more, but we have a number of them. And you also, I'm sure you're also aware, we have telephone services when there is crisis that could be called for people to seek help. We have in our hospital here, we have our hotlines that's 24 hours on. You can call. Maybe this will be given before the end of the day. We also have the Nigerian Suicide Prevention Initiative Counseling Center hotline. These are in times of crisis. These are numbers that you can call, and you'll be given assistance. We also have the Youth Center for Suicide Research and Prevention Initiative. So there are a number of services around for acute, and then where you can take an individual to for further assessment and proper care. Thank you.
All right, thank you so much, sir. He had ruled out a lot of information, various centers where we can access help. Part of what we do at Yaba Voice is to also assess. By the end of the program, we're going to be sharing our outlines with you that you can also connect to it to be able to access help or to be able to refer individuals who need help too. Okay, Mr. Peter Deniboyon, there are a number of suicide cases that have been experienced in our community. Is it possible for us to be in collaboration with our Center for Proper Assistance? I think yes, the answer is yes. We are available. Yaba Voice is available for collaboration. The Federal Neuro-Psychiatric Hospital is also available for collaboration. You can please access us. Like we said, we have various platforms. We're on Twitter, the Instagram, and the Facebook. And so you can always link up with us on there on whatever you want us to do, and then we'll be ready to give you the help that you need. Oluremi, we see your question here. Please, considering the limited spread of psychiatric facilities in Nigeria, does your hospital have plans for community-based intervention? Mr. Peter, can you talk about this?
Thank you so much. I believe strongly that things will get better, being that we are under federal, but we can still, and we are always in a community to help people who are having issues. And our hospital has been trying, because we go around in communities to make sure that we attend to people who might have mental issues or challenges, whereby we can be of help to them. So we are free. I mean, the hospital will be glad to receive people who want to collaborate with us, who wants to work with us, so that we can move into the community. And we cannot achieve all these things without finance. So if we have corporate bodies, if you have people, philanthropists, who have what it takes to take us to the community, we'll be glad to be at every nook and cranny of our community to reach out to our people. So we don't want to sit down here in Yaba alone. We also want to go into the community. But once you have financial constraint, when there's financial issues that has to do with, I mean, getting all what it takes in our community, it might limit our going to the community. But if you have people who support us very well, then we'll do more than what we are doing right now, if you have a support from other people. Thank you.
All right, thank you so much, Mr. Peter Deniboyon, for that response. The medical director, too, also have an information to give about what we do as an hospital in terms of community services. Dr. Osiogo, want your response on that last question. Are we in the community?
Thank you very much, Femi. And thank you for the question that you asked. Yes, this webinar is actually an psychiatric hospital, Yaba. Before the coming of COVID-19, we were always in the community. We were in the mosque, in the churches, in schools, in marketplaces. Yaba is known for that. And part of our community efforts, the hospital has an outreach post at Badore in Lekki area of Lagos State, where we are taking care of children and adolescents with the effort of a school there that's called us. So we are ready. We have always been ready, and it's not just starting. It has always been a part of this hospital to reach out to the unreached. We've always been there. Now with the coming of COVID-19, we felt part of the outreach program is that we felt that what could we do again to reach more people, to reach the people, because we cannot, because of social distancing, we cannot go to the market, we cannot go to churches. So that was how this one started. As regards what we can do for people that are not within Lagos State, there are psychiatric hospitals scattered all over the country. We can always associate with you, but the first thing is for you to go to the nearest centers that are very close to you. But if you still need more help, we are always there for you. Thank you.
And the summary is, we are always here for you. And that's coming right from the office of the chief host and the medical director. Dr. Oluwani, I want you to take this question, sir, before we begin to think of rounding up. And that's the fact that, yes, physical possession does not stop suicide. I know you have confirmed that. But then again, we said, how can we now begin to look at, yes, the social media? I know you mentioned that too, but I want you to quickly just address that. How can we now begin to help the social media to understand that when they begin to give very, very clear, vivid details about the way people commit suicide? Does it have any effect on people and other things like that? In 1 minute, sir.
Yeah, thank you so much for giving me the opportunity to re-emphasize that issue that I touched on before. When you disseminate graphic information, details about suicide, you are not helping. You're showing picture of somebody who has taken his or her own life. We are talking about the method that was used. Some of this will even be made up. It's not even what happened. And people go to any extent in this day of social media to come up with a lot of graphic, what I will call horrible things. This we should know for all those of us who are listening that it does not help. We talk about what we can do to strengthen our resilience. We don't want to put fear in people. We don't want to, the vulnerable one, when you talked about what negative thing that has happened, those who are vulnerable will go on and carry out the acts, and we don't want that. That's why it's wrong for us to disseminate wrong information on social media. Yeah.
All right, thank you, Dr. Oluwani. This webinar is for 1 hour, but I know there are lots of questions, and I know people still have issues that they want to tap into. Yes, you could also link us with us on Twitter, Instagram, on Facebook. We'll be able to take that. But then I want Dr. Oluwani to quickly address this. Somebody is asking and is passionate about this. And the fact is that medical services in the country seems to be, yes, on the high side. And part of the reasons why people have depression and all factors that are responsible for suicide is the fact that they have low means of livelihood, unfulfilled life expectation, and poor support system. How can we help people like that? Then he's asking, and I know it's in the hearts of so many other people too. How can we help people cope with this now? They can't come to the hospital. Yes, they are sick at home. What can we do?
Yeah, thank you. Like you said, poverty is known as one of the factors that may predispose an individual to depression and even carrying out suicide. We can all do something. I can help one person. Two of us can join together to help the nearest person to us. This is part of our responsibility. If we all take it upon ourselves to help the nearest person to us, we become our brother's keeper, then the effects will cascade, and then we'll be able to help many individuals. So if we are waiting for something to happen on a large scale, nothing may not happen. So let's start in our own individual corners to make a difference in people's life. And by so doing, cumulatively, we will have helped a lot of people. Thank you.
All right, thank you so much, sir, for that response. Somebody asked about the math. I guess the pronunciation is right for Mr. Francis. Sorry, Mr. Peter. And then he's saying, is it all suicidal attempts that requires math? Please, 1 minute, sir. Can you just attempt that?
All right, thank you so much, the moderator. When we talk about math, the full meaning of math is medication-assisted therapy, which is very, very key when you are trying to treat someone that have suicidal ideation or have suicidal attempts. Because there's no how you treat a patient without using medication. Apart from the medications, which we've talked about, math, we also have psychotherapy or counseling sections, whereby this person that has suicide ideation or suicidal attempt can go through this. And because this, when we talk about mental disorder, it has to do with chemical in the brain, the dopamine and the serotonin in the brain. If they're not balanced, there's tendency for that person to start having issues with his or her life. So if that person is well medicated, then there will be a lot of resolve in person rethinking about committing suicide. Thank you.
All right, thank you, Mr. Peter, for your response. Michael, yes, your comment here is saying that we can use MED as well, that it's a therapeutic approach. Yes, we are learning, we're expanding. From Galaxy Note 9, what provision can be done for clients who can't even afford coming to the hospital, talk less of buying medication, and that's why support is needed. Every one of us needs to be able to go out one way or the other to just better the life of the people. From Benga Kulate, the comment is, let's be mindful of people who go to a great length to conceal that they actually die of suicide. For example, people who get drunk and they have motor accident and then hit people or other people, it could be quite risky too. Thank you so much. For Michael, talking about collaboration or joining institutions, yes, what we do at Yaba Voice, we would like to collaborate with you. We might, yes, information and other webinars and things like that, we would love to do so much of this. Yes, it's hand has been raising up. Charles Oguntade from I learned you from Australia. Can you quickly be unmuted? Please let's unmute him, please, so that he could, Charles Oguntade. And in 1 minute, please, can you just let's hear your voice? I can see your hand has been up all through the webinar. Can you please let's unmute him? Can we identify him and unmute him, please? All right, please unmute yourself. You've been given permission to do that there. Charles Oguntade. Oh, I think he just left the webinar. We're sorry about that. We would have loved to take comment from everybody, but because of the time constraint. Yes, we are over the seminar now. We want to thank you. Thank Tolu Lokwe. I would like to know how, oh God, questions are coming in. I know. What about clients with reactive depression? We will not be able to take on, but then the truth is we are going to send responses to all our platforms. The responses are going to be sent to all our platforms. Thank you so much for joining us today. Today has been beautiful. Our hotline is 081 3820 9409. Again, 081 3820 9409. And the second one is 080 75 25 1315. 08075251315. We are happy to have you here. Please connect with us on Twitter, on Instagram, on Facebook. And then in the next week, by the grace of God, we'll also be having another webinar. The topic is too much or too little, sleep and sleep disorder. Too much or too little, sleep and sleep disorder. Thank you very much for being part of this here. Last word from the medical director and the chief host.
Thank you very much for everyone that actually came here. But I'd like to thank most especially Her Excellency, who is there present. I won't want to mention her name. Thank you very much, ma'am. Thank you so much. And thank you to everybody that I've seen. Thank you so much.
All right, so thank you so much for being part of this webinar. Like I said, the questions will be addressed on our platforms. Please, you can just check it up on it. And please share. Please feel free to share all that we have done today. Share the Yaba Voice platform because yes, quality mental health information will be shared there. We're happy to have you once again. Please feel free to join us in our next webinar. Thanks for being here. God bless you.
Bye.